Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is April 22nd, and this is our weekly COVID-19 update. I am here today with a member of our team who you may not have seen yet. This is Angela. Angela, do you want to introduce yourself?
Absolutely. Hi, everyone. My name is Angela Sublette Knight, and I am the COVID-19 Transportation Access Coordinator here with the UG Public Health Department.
Great. Thanks for being on here today. Do you want to, so today we're going to talk about the Transportation Access Program that you coordinate, what that is, how it works, what people need to know about it. So do you want to just start out by talking about what is the Transportation Access Program?
Awesome. I'd be excited to talk about this. This is a new program offered to Wyandotte County residents. It is called the Transportation Access Program. Any Wyandotte County resident who is needing transportation to their vaccine appointment can receive one by going online and clicking the link that says, "Do you need a ride?" Or they can call 311 directly, and an agent will be able to submit a request for them. It was imperative that the Unified Government Public Health Department and our county have a transportation program for our residents. We know that we have populations of residents who are most vulnerable and don't have transportation to vaccines or to receive their vaccines. So we have launched this program in partnership with the Unified Government Transportation along with Uber Health. And so we can provide residents with rides to and from their vaccination appointments. We also can provide transportation for those individuals who are on site. They got here, but they don't have a way home. And so we are able to schedule a ride for them on demand. And so I'm really excited about this program. And it's brand new, only a month, but our residents are catching on to it.
Great. And you already told us about how they can sign up. So they can go to our website, whitecovaccines.org, or they can call 311. So let's say you're an individual, you signed up. How does it work once the day of your appointment comes?
Great. Okay. So what happens is you go online or you call 311 and the agent will take your information or you put your information in. And within 24 to 48 hours, a health department community health worker will contact you and they will go through some questions with you to kind of see what your needs are. And so during that time, they will ask what's the best time for you. And at that moment, you will be able to tell them when you want to come. On that call, they will schedule your ride, whether it's UG Transit or Uber Health. And then the day of your appointment, if it's UG Transit, you will, the community health worker will call you and remind you that your appointment is tomorrow or when it is, and that UG Transit will be there to pick you up. If you choose if Uber Health is the option and you have a smartphone, you'll receive a text. And with that text, you'll be able to track your driver, know when they're coming. And so it's super handy. You don't need the app to do it. So it's not necessary. It's all done through text. If you have a landline, it will send you an automated phone call. So the day of your appointment, your transportation arrives. They will drop you off at one of our 3 vaccination sites. And that be whether it's the Armory, the former Kmart, or the former Best Buy. Once you arrive on site, you will be greeted and you'll go through the vaccination protocols. Once you make it to observation, then you will see our big yellow signs that say, "Do you need transportation?" If you've arrived with UG Transit, you'll have a yellow slip and you'll just take that yellow slip to the table. If you came Uber Health, you'll just notify the table that you came with Uber Health. and they will call your ride. And they will notify you when your ride has arrived. The community health workers on site, they all have iPads. So if you choose, if Uber Health is the option, then they will be able to see the driver arriving. They can communicate with the driver. It's amazing. It's a great opportunity. Hopefully soon we will be partnering with Lyft as another option for our residents as well. So we are trying to have as many options as possible for our residents to be able to get to their vaccine appointments.
All right, great. It sounds really easy to use and convenient. And thanks for walking us through like what that actually looks like to get your vaccine. So if an individual needs a ride, we heard how that works. Is there an option if there's like a group that needs transportation to get to our vaccine sites too?
Awesome. Yes. So it's brand new. So that same form that you submitted for an individual, you would use that same form for group transportation. So you would go through the same steps, tell me about your organization, and then I will contact you, or a community health worker will contact you, and get that all scheduled. And so we are able to do that in partnership with UG Transit. So they do have vehicles large enough to transport a particular number of individuals to our vaccination site. The process will still be the same. You'll go through the vaccination protocols, and then your lead or someone will notify the transportation table that you're here as a group. And so we will just call and get them to come back and pick you up. And so I'm so excited about this. Hopefully our community organizations, community groups, smaller groups will be able to take advantage of this.
Yeah, that's great. So if you're out there and you have a group of folks who you think would want to come together to get vaccinated, this is a great option to explore. Another option as well is my understanding is that on this request form, it's also for folks who are homebound and wouldn't be able to come to our sites. They can submit a request as well. How does that work?
So I'm so glad you brought that up, Janelle. So we do have a service where if an individual is confined to their home or cannot leave their home for health reasons or other reasons, we can schedule our mobile unit to come out and provide vaccine to you in your home. The mobile unit will come out with an EMT and a registered nurse and issue that vaccine. The process is still the same. You'd complete the form online. A community health worker will contact you, and then we will get you, and then your information will be sent over to our mobile vaccine unit, and they will call you and schedule you for that. Most of our at this time, all of our homebound vaccinations are done on Wednesdays, and so they will come out and give you that vaccine in your home.
That's great that they'll come right to you. So it's a good option to have available because we want to make sure that everybody in Wyandotte County has an opportunity to get vaccinated, and it's not going to work the same way for everyone. People need to be able to access it in different ways. So that's really great to hear. Is there anything coming up with the mobile vaccine unit that you want to mention?
Yes. So we have been doing the mobile vaccine unit for a couple months, and it has been successful. And so now we are going to be looking to do outreach. So there will be a form up online for groups who want to host vaccine clinics at their sites. So that will become available to our community soon, and very, very soon. So I'm excited about that as well. It's a part of the health department's mission, the state of Kansas, to get all of us vaccinated so that we are safe from COVID.
All right, great. So yeah, again, details on that are coming soon, and the way to submit. And if you're interested in doing that for your group is going to be coming soon. So we'll be posting more on our social media when we have more details, and on our website when we have more details.
Yes, and so please keep your eye out for that. And if you have any questions, you can reach us at COVID Transportation at ycokck.org. Again, that's COVID Transportation at ycokck.org. And we can answer any questions that you have in regards to that. If you forget the email address, just go to our website, the UG hub, and our web address is right there. And you can just click and send us an email with any questions that you have.
All right, that's great. I want to wrap us up today by giving folks a reminder about just our general vaccine eligibility and hours right now, because I know things have changed a lot throughout this. So always want to let people know where we're at right now. So if you live or work in Wyandotte County, you can get vaccinated at any of our 3 sites with or without an appointment. If you are using the transportation program, that would be with an appointment through the request that Angela told us about today. But other folks, if you want to just drop by when it's convenient for you, you can. We have all of our latest hours posted at wycovaccines.org. Or you can find out more by calling 311. We still have most of our Monday through Friday hours, 9 a.m. to 2:30, but we have one day a week at the Kmart where we're open a little bit later, and one day a week at the former Best Buy where we open up earlier in the morning. And we also still have some Saturday availability at the Armory as well, which is great to be able to offer some different hours for folks. In addition to that, any other Kansan, even if they don't live or work in Wyandotte County, can set an appointment. We have some appointments left available on Tuesdays, Wednesdays, and Thursdays. So if you maybe are in a neighboring county and you want to come get vaccinated at one of our sites, then please go online or call 311 and make that appointment. All right. Well, I think we need to go for today, but thanks again, Angela, for talking about these transportation services.
No problem, Janelle. One more thing, I almost forgot. We will have expanded bus routes starting in May 1st. So if you are one of our residents that use our bus services, we will have extended bus routes on Saturdays to the Armory for those vaccines. So please that's going to be the bus 118, 103, and 102, and of course the 106. And so it will get you to the Armory, and you'll be able to receive your vaccines on Saturdays. We also have our transportation available on Saturdays as well. So I almost forgot to mention that. Thank you so much, Janelle, for this opportunity to talk about the Transportation Access Program and what we have coming up for our residents.
All right, great. Yeah, thanks for adding that. I'm glad you thought of it before we wrapped up for the day. All right, thanks so much. We'll be back next week.